Hi, I'm Camilla Frankish, and I've been researching behaviour and attitudes around milk donation on behalf of the UK Association of Milk Banks. In this presentation, I will go through with you some research background, the objective of my research, my methodology including ethical limitations and considerations, key findings, and to close, my conclusions and recommendations. To start, I will give you some background, including the wonder of breast milk and the current state of milk banking in the UK. Breast milk is the ideal food for babies. It contains all the nutrients that a baby needs, at least 400 actually. It also contains hormones and disease-fighting compounds that simply can't be found in formula milk. And while this is great for all babies, for premature and vulnerable babies, receiving donor milk can be the difference between life and death and reduce the risk of long-term health problems. Despite this, very little is being done to promote breast milk donation. There's not a lot of information and you have to be a bit of a detective to find it. The process of registering as a donor is unnecessarily complicated and it is quite a commitment requiring time, effort, preparation and sometimes cost. The situation is also very different depending on where in the country you are. Milk banks generally run as individual charities that rely on financial donations, volunteers, which means that they all have different systems and arrangements in place. Although the UKMB are working on creating more central organisation, that is currently not the case. The impact of all this is that donor milk is not widely available except for the most vulnerable babies. Because of the cost and time investment of accepting new donors, it is important to try to educate and get expectant mums to consider donating as early on as possible in their breastfeeding journey. Breast milk donation also doesn't appear to have the same status of importance as blood products, bone marrow and organs. Unlike blood banks, many milk banks that were closed during the AIDS epidemic of the 1980s were never again reopened. I wanted to find out what the situation is with milk banks in the UK and what the day-to-day life looks like for breastfeeding mums. After doing my initial secondary research on the issue of breast milk donation and infant feeding as a whole, I started with interviewing Esme Malem, an experienced breastfeeding peer supporter who runs breastfeeding support groups and writes the breastfeeding information booklet that all new mums in Cornwall receive. She had some insights around informal milk sharing that's happening, partly because of the lack of milk banks. She invited me to attend her mum's group and signposted me to Stephanie Hurd, who is a specialist health visitor and joint infant feeding coordinator for Cornwall. I contacted Stephanie and arranged a phone interview with her. She was very knowledgeable and experienced and was able to give me a good overall grasp of the ins and outs of infant feeding. And she's also in charge of the UNICEF Baby Friendly Initiative accreditation for Cornwall. I attempted to set up interviews with someone from the neonatal feeding team and coordinators from the Precious Drops Milk Bank in Bristol, but I was unsuccessful. I wanted to build a picture of what the day-to-day life looks like for a mum with a young baby and see what habits, routines around breastfeeding are. So I conducted an 8-day diary study with a mum and her 3-month-old baby. She logged around 8 to 10 times a day from February the 14th to the 21st, building a picture of their routines, whereabouts and their breastfeeding habits. I then visited a Falmouth breastfeeding support group on the 4th of March, interviewing mums both individually and in small groups. I asked them about their breastfeeding journey so far, awareness, information, experience about milk banks and milk donation, and also about breast pumps, pumping habits and motivations. A potential drawback of this method could be that it can be difficult to make accurate deductions from non-standardized answers, but I favoured this method as I was able to get insights that I hadn't asked for. I didn't feel that I had a large enough number of participants to be able to draw general conclusions from surveys and numbers-based research. In order to attend, I had to gain permission both from Real Baby Milk and the Falmouth Family Hub and present the purpose of my visit and my ethics statement and showing them that I had an understanding of how the early days with a newborn can be a time when a mum feels particularly vulnerable and also privacy concerns around breastfeeding. I then also had to get individual consent via a form from the mums attending in order to record audio, and from the ones that were happy to appear in photographs. On to my key findings. 1. A lot of breastfeeding women do own a breast pump. An estimated 85% of USA mothers of infants aged 1.5 to 4.5 months are expressing breast milk, mainly using electric pumps. An Australian study identified that around 46% of mothers of healthy term infants were expressing breast milk in the first 24 to 48 hours following birth, and that 47.9% of first-time mothers in the same study already had a breast pump before birth. Unfortunately, no such official statistic currently exists for the UK, but many breast pump manufacturers report big sales increases in the last few years, and my conversations with breastfeeding mums certainly support this. A lot of breast pumps are also purchased second-hand and passed down. 2. At the moment, no information is given to expectant mums about donation, and as you can see through this customer journey map, there are plenty of contact points that could be utilised, starting with the first midwife appointment, the ultrasound when you normally receive the bounty pack, breast pump product websites and forums, through to the actual birth, follow-up visits and breastfeeding groups. The 6-week checkup could be especially useful as mums are then starting to find their feet and gaining confidence. 3. As noted by Stephanie Hurd, breast milk, as something that is vital to survival for vulnerable babies, is simply undervalued by society in general. 4. A lot of other countries are doing a better job than us, and not just Western ones, notably Brazil, but also Norway and Italy. 5. The blood bank network is already being used for transporting donor milk. Is there perhaps scope for more collaboration between milk banks and blood donation services in terms of screening, etc.? 6. The general attitude towards milk banking amongst breastfeeding mums is positive. Which brings us to my conclusions and recommendations. The fact that a lot of breastfeeding mums own a breast pump, have a positive attitude towards donation, and may have surplus milk is a missed opportunity for milk banks. If, for example, they were given timely information at their 6-week checkup and offered blood screening and containers there and then, I think that would help donation rates enormously. Much more could be done antenatally in terms of information and education from the NHS, breastfeeding support networks and milk bank organisations. Breast pump manufacturers could do a lot of raising awareness at the point of purchase through web, social media and sponsorship, especially in the bounty pack and sponsoring milk banks with equipment to lend, etc. And that concludes my presentation. I hope that the data presented here will be helpful towards improving the situation for milk banks and the donation rates. Thank you very much for your time.